Good morning, everyone. My name is Gudeep Chabra. I'm a medical oncologist, a hematologist. I think I've been the longest working here amongst the faculty. I've been here since 1997. As a matter of fact, I even did my residency at at University of Maryland, Capital Region Health. Well, that is before it was Prince George's Hospital Center prior to this. And then I went and did my fellowship in hematology oncology at Washington Hospital Center. So I've been around here because this area has a lot of pathology. The patients are phenomenal. We do have a lot of need for physicians in this area to be able to take care of these lovely patients that we have. We at the same time we've been expanding our services. Most recently, we added interventional pulmonology, which is really working very well. And we have a robust thoracic oncology thoracic oncology tumor board at this point. Additionally, we also have a very strong GI program, which does invasive procedures, EUS for staging, and we have a good GI uh, board also looking into different cases, different pathologies that we discuss on a regular basis. And then we've also added a very strong breast program. We have a dedicated fellowship trained breast surgeon, and we have a repertoire of medical oncologists who are coming into this institution. So we do see a lot of breast pathology also. Um, Additionally, we've been working on making sure that we have a very strong ambulatory program. We have residents who are going into the community and looking into different addiction medicine observerships, electives. We have folks going to do rheumatology electives. So we really built a robust outpatient ambulatory program for the residents to be able to have a broadened their experience at this point. Um, I think I would say that with the with Dr. Salters now at the helm of affairs, this program is just going to be growing in leaps and bounds. And we've also been joined by Dr. Lavelle, Helen Lavelle, who is another associate program director, who are really master educators. And I think the even bigger things and better things are going to be happening at our University of Maryland Capital Region Health. I hope this gives you a little bit of insight into what's going on in our program, and we welcome you to come and see it in person. Thank you. Nice meeting you guys.
Hi, I'm Helen Lavelle. I'm the new Associate Program Director. I'm very excited to be joining the program this year. I'm excited for the direction that it's going in with Dr. Salters at the helm and the ability to innovate in the kind of small community hospital setting. I'm very excited to introduce myself to you guys today and hopefully work with you in the future. One of the things that I'm most excited about this residency is we are piloting a new noon conference series as well as a morning report series. We're doing kind of themed group weeks, and we'll be doing talks and humanity lectures to kind of help tie everything together. The other things that we're doing this year that are new are we're implementing a new board review curriculum, and they've started a new schedule, which I think the residents are happy with. All right, one of the other things we're going to be working on this year with the residents is developing a new procedure-based elective and procedure training. We'll be using SimLab to do ultrasound-guided IVs as well as lines and procedures, and then we'll be doing more focused procedural training. One of our core values is education, and that's one of the things that we're going to be working to develop over the course of the next several years as well. We are integrating a lot of different conferences, like I was talking about, a board review curriculum. We're also doing an ambulatory half day, which is brand new to the residency as well. Our main goal is that we want to develop competent, pluripotent providers that can go into whatever field that they choose, but they're also compassionate physicians.
Hello, my name is Dr. Clarence Findlay, and I'm one of the interventional cardiologists here at University of Maryland Capital Region. I actually grew up in the area, not too far from here, maybe about 15 minutes. So I'm a Prince George's County native who was fortunate enough to leave for about 25 years and experience different parts of the medical system and different hospital systems, and then bring that expertise back to the area. I am a structural and coronary interventionist, so I do things like stenting, closing holes in hearts, replacing heart valves, sampling pressures in hearts, removing fluid from around the heart. And since I've been here, I've worked with the residents quite routinely, and in the way of either giving lectures that are cardiology centric, and or having individual residents rotate with me one at a time. We do try to get their hands dirty so they can understand what it means to be an interventional cardiologist. So they will do procedures with me, touch catheters, get access, all of which I think are important for you to have a better understanding of what it is you may be going into if this is a potential perceived or desired career path. Work closely with Dr. Salters as well, and in terms of trying to enhance and develop the curriculum here to make it a little bit more cardiology centric, but at the same time to ensure that the residents get what they need as far as training and understanding of cardiology to move to the next level.
Hello, my name is Dr. Imran Siddiqui. I'm the chair of the Department of Critical Care here at University of Maryland Capital Region Health. My pleasure to introduce our critical care department, which works with our residency program to train our residents. What is important is I think up to 50% of residents go in inpatient-based subspecialties or into hospice medicine. And I think it is very important to have a strong critical care experience for these subspecialties as well as hospice choice. We provide very dedicated experience in not just neurocritical care based issues, but also in cardiac critical care based issues, which prepares our residents for career in hospice medicine as well as inpatient based subspecialties. We also have high acuity in our patients, which allows the resident to experience how to react in these high acuity situations. In addition to that, the residents also get to learn how to speak with patients who are in a difficult place. Many of them are not doing well as to talk with families of patients who are grieving or severely stressed. I think that environment is very important for residents to experience because that certainly prepares them for difficult conversations in their career.